New COVID cases and those in hospital in the US are down significantly. Dr. Julie Morita served on the transition team's COVID-19 advisory boards with me now. Doctor, I appreciate your time. So there is a noticeable, I mean, I live here in New York, and there was a noticeable difference. There feels to be more energy. There feels to the whole campaign, to the vaccination and this, that and the other. And the numbers have come down. But you just heard me talking about the United Kingdom. There's a real risk in the US, isn't there, that the complacency sends the numbers back up again?
Hi, Richard. Thanks for having me. I think you pointed out clearly that we are achieving a grim milestone here with 500,000 deaths because of COVID. And I think what we all have suffered throughout this past year and are ready for a change and ready for hope. But I think it's a little premature to be celebrating just yet. There's reason to be hopeful because we have 2 excellent vaccines that are available, a third that's being evaluated by the FDA this week. And there's reason to believe, and our rates are coming down. But even though our rates are coming down with COVID, we still have higher levels than we'd like to see and higher levels than we had in the fall. So I think really we need to continue to do the things that we've been doing in the past while we're waiting to get vaccinated. And that means the mask wearing, the social distancing, the washing hands and avoiding crowds. Those things are all critical still.
This is a complex question seeking a simple answer. Is there one thing that the US did wrong? Go back to last year. I mean, we can talk about the opening up for Christmas and we can talk about opening up for Thanksgiving and all of these other things. But if you go back to last spring, early summer, is there one thing that the US did not do that it should have done?
So I guess as a former health commissioner in Chicago, I was there for 20 years and lived through many public health emergencies, and many of them at a national level. So things like Ebola or H1N1 or Zika. And the strongest responses that the U.S. government had were when there was strong federal leadership and clear and consistent communication regarding what the public health measures are. And I think we knew early on with the public health interventions that would likely help us decrease spread, and that meant the mask wearing, the social distancing, the avoiding crowds and hand washing, those kinds of things could really make a difference. What I think we're seeing now is more consistent and clear guidance about the importance of doing those things. I'm really pleased that we have actually had such a great vaccine response, that there's these 2 strong vaccines available already in less than a year's time, and we're already vaccinating people. But we still have a lot of work to do. And so when I look back over what could have been done better, I really feel like a strong, coordinated federal response with clear and consistent messaging really does lead to a better, stronger response for any public health emergency.
Do you think we're getting ourselves tied up in our own data? I'll give you an example. You've got the AstraZeneca, which is not being used in over 65s in certain European countries because there wasn't enough of the over 65s in the 3rd stage. You've got in this country, you've got a variety of different questions over whether the first vaccine gives sufficient, should the gap be longer, even though the latest Pfizer data shows 85% efficacy. Do you think we've tied ourselves up in knots on this?
I think the data are essential for us to make sure that we're doing the right thing and protecting people as effectively as possible. And so we are reliant on data. I think what I like to do is I look at what's currently recommended by the FDA, what's been approved by the FDA in the United States, and also then recommended by the CDC. I follow those guidances and those recommendations while other studies are being done. It is so important to have additional work done and additional studies being done to make sure that the vaccines are as safe and effective as we thought they were, and also to make sure that they work in the real world circumstances like they did in the clinical trials, and also to see if there's ways that we can actually improve the vaccine. So can they be stored in warmer temperatures, or can they only 1 dose be given? But it's premature to make changes with the vaccine schedule until we have full data available. So I don't think that we're tying ourselves up in knots. I think it's really important to focus on what's being recommended and following through with those things while these additional studies are actually going on.
Doctor, good to have you. I appreciate your time. Thank you, ma'am.